Welcome to the Empower Hour with Greater Nashua Mental Health. The Empower Hour will provide information and support about mental health, substance use, and behavioral health. Our goal is to share inspiring stories about transforming lives, to strike down stigma, and to encourage our community to reach out and get help when needed. Mental health is part of all of our lives. It's time we talk about it. I'm Dr. Cynthia Whitaker, President and CEO of Greater Nashua Mental Health, and it's time to get empowered. Hello, and welcome to the Empower Hour with Greater Nashua Mental Health. I'm Dr. Cynthia Whitaker, the President and CEO at Greater Nashua Mental Health, and it's my privilege to host this show whenever we can, talking about the great services that we provide, as well as some topics related to mental health, and to have some special guests on to talk about some great things. Today, the topic we'd like to talk about is one of our values at Greater Nashua Mental Health, which is collaboration. For us, that means that we recognize we can't do things alone. It recognizes that we're stronger together, and it recognizes that others have strengths that we don't have. And the best way to work together is to honor those strengths that we see in one another. And who better for me to talk about collaboration with than none other than the president of the United Way of Greater Nashua, Mike Apfelberg, who's also my dear friend. Welcome to the show, Mike.
Hi, Cynthia. It's so good seeing you in person.
In person, not on a Zoom call.
Not on a Zoom call.
Although those are all right too.
They usually are, yeah. I'm not going to complain.
So as I mentioned, collaboration is one of our values. So our values at Greater Nashua Mental Health are collaboration, compassion, of course, authenticity, and then creating an empowering environment for people. But really wanted to just talk with you today because I really do consider you in the United Way kind of like the king of collaboration or the epitome of collaboration here in our community, where you really bring together a lot of different folks. And so I just wanted to have a conversation about why collaboration is important to you, to us, to all of us, and really to our community.
It sounds like a great topic. You know, it's funny you talk about this being one of your values. I would have to say this is our value. Above all others, really. In fact, our tagline at United Way is that great things happen when we live united.
Right.
And living united is just another way of saying, you know, working together to get work done. So I think it's really one of the most important things we can possibly do is to recognize that the big things, the hard things, the really challenging situations can only really be resolved when people come together and bring different skill sets, different organizational capacities to the table. You know, you can get a lot done at Greater Nashua Mental Health by yourself. You know, other organizations can get a lot done by themselves. But to be really effective, our belief is that we all need to kind of pitch in. And we call that model, well, we call it collaboration, but we also call it collective impact.
Absolutely.
And that's kind of, I just think, a wonky and kind of fancy way of saying working together to get stuff done.
Right, collectively making an impact because we can have more impact together. And I would even say even greater than the sum of our parts.
For
right?
sure, absolutely.
Right? When we pull together our resources, we pull together our ideas, our funds, whatever it might be. So where have you seen that really come to be for our community? Like, is there an example or two that sticks out for you?
Yeah, there are more than an example or two. I'm going to say there are a lot of examples. We have probably the example which is kind of nearest and dearest to my heart is around homelessness. You know, homelessness, if you think about it, is a really intractable problem. It's not an impossible problem, but it's a big problem. And it's complicated and it's multifaceted. There's a lot of layers to it. So we have an organization which is a sort of collective impact initiative in our community called the Continuum of Care. People always will call me and say, where do I go for this? Or where do I go for that? And I say, let's step back from this for a second and say there's a lot of different resources available in our community, but they're all kind of around that table of this continuum. So, it's my sense that when we look at our responses to homelessness in Greater Nashua, that we don't always hit the mark, but we're more effective than a lot of other places are, because we do have, really this culture that says, we have Greater Nashua Mental Health, which has resources to, they can bring to bear, and expertise around homelessness. For example, your colleague, my friend Sue, who does a lot of the outreach work. And then we have other organizations like the Public Welfare Office and our friend Bob and what they bring to bear. And then we have organizations like Stepping Stones and Family Promise and Southern New Hampshire Rescue Mission that all provide direct services to people who are experiencing homelessness and either need an emergency, everything from emergency shelter to get out of the cold and the rain, to get a meal, to get on the path to self-sufficiency. It takes a lot of different people coming together to solve these problems. I know it's kind of cliche, but there's that old phrase, it takes a village. And I really believe it does take a village to raise a child. It also takes a village to solve these problems.
Yeah, one of my friends, one of the things he often says is healing happens in community, problems get solved in community, right? Like if there's something that needs to be fixed, you look to the community, because any one of us is going to do it from a narrow view, but putting all of those pieces together, so the outreach that we do, that others do, public health does, they've really stepped up their outreach alongside others who provide more services. And it just really needs all of that to solve.
Yeah, and it takes a long time to get, sometimes you're in the thick of it and you don't really realize how well you're doing or what kind of progress you're making. Sometimes you feel like you're not making any progress at all. But then if you take the long view and you step back from, the situation at hand, you say, well, where were we 2, 3, 4, 5 years ago? Where are we today? We can't control the environment that we live in. We can't control the economy that we all exist as a subset of. We certainly have only limited influence over issues like, access to affordable housing. But those are levers that are long-term levers. But what we can do is we can look at it and we can say, yeah, we are actually getting somewhere, even if it doesn't always feel that way. We really truly are. So for me, homelessness is probably the one where I see the most collective impact taking place. There are, of course, other big initiatives that have been going on for a long time that, we can talk about, that maybe sometimes it also doesn't feel like you're making that progress, but you are. And so substance use disorder is a biggie. You and I have been involved with that fight for a while now. I think actually you and I might have even met at one of the mayor's
opioid task force initial meetings. That's right.
Very early on, and I said, "Who is that woman? She seems really smart. I gotta you always gotta hitch your ride to the smartest horse in the stable, right?" So that's you, Cynthia. But the mayor's opioid task force, it was really initially our community's collective response to a deep problem, the problem of overdoses and addiction, especially as it relates to opioids. Now, we all know that there's more to it than that. That's just a substance of many. Yeah. And it's one manifestation of this really, difficult disease. But sticking with it and bringing partners around the table, like, again, yourselves, but also like Revive Recovery and the public health folks and the Nashua Prevention Coalition.
The Doorway.
The Doorway, and even our first responders who, for a while we had our Safe Stations program, but we still and we don't anymore, but we still have first responders on the front lines, whether they be fire, ambulance, EMT, police to responding to these issues. So we're making progress.
Yeah.
It's just sometimes it feels like one step forward, one step back. It's a dance, but you are getting somewhere.
I love that example. And in fact, I use that example. I have pictures from some of the initial meetings where we drew on the whiteboard and made all the points of impact and points of entry into the system. And I use it as an example when I teach, actually, about collective impact in the community psychology class that I teach. And why I love that example is because there were some tangible, quick things that happened as a result of that group coming together. And then there's some things that are still happening. I mean, the group's changed its name so that it is now more inclusive of all of substance use and not only opioids. And but often people have that reaction even when I teach about it. Like, well, what did you really do? It's not like you solved the problem. It's like, yet we made the community better.
We did, absolutely, and we continue to.
Exactly.
In fact, are you going to be at the meeting tomorrow morning?
Tuesdays are a tough time.
I know they are for me too. No, but I'm just kidding. But no, if you think about the early conversations with the whiteboards and whatnot, one of our big concerns early on, this is years ago, right? 6-7 years ago at this point, we knew you could see the problem, you could pinpoint some of the manifestations of the problem. The big issue that we had is we had nowhere for people to go.
Right, immediately.
There was no immediate response. So that's when, we came around this idea of safe stations, right? And like all great ideas, the best ones are stolen from someone else. So we'll give our friends up in Manchester some credit for that. But it gave us a way to bring people into treatment. And then we started to talk about, well, what about harm reduction? Like, what do we do if people aren't ready to go into treatment, but we don't want people to do harm to themselves or put themselves at great risk? At some point, if we can simply prevent the severe consequences of an overdose by providing a little bit safer of an environment. It's a controversial topic, but it's one that we stand by, and I know it's one that you stand by, that then at some point, by creating human connections, people will then also seek out treatment and seek out support. So we then created our community. I'm not going to say we, because it's not a United Way thing. It's like our community.
Our community, our collaborative,
created the SANA effort for harm reduction, what people in the vernacular might call needle exchange, but that's really more than that. It's really a harm reduction strategy. But these are things that we've done along the way to improve the process, improve the system, and none of that would have happened with any single organization saying, I'm going to do that thing.
And especially not with the impact, right? Like, I mean, if there had been an organization that was on its own providing this harm reduction, but none of us knew or weren't connected or weren't part of it, it wouldn't have been utilized the way that it is. The same is like with naloxone or Narcan. I was watching some numbers recently about how much of it is administered and prescribed in our communities versus some other communities. And we've done a really good job in our community about making sure Narcan and naloxone is available, even though the state had some efforts in there, but as our collective, we made sure people had access to that information. We gave it out. I
remember way back when the state was initially saying that naloxone would be available for free in drugstores for people who came and identified it and asked. And so I said, well, I'm going to test the system out, and went actually myself to a couple of different drugstores and said, I'd like to, I've heard about naloxone being available. I've heard about Narcan being available. Is it? And it wasn't. And they're like, well, who are you? And what do you want? And why are you talking to me? And it was very scary back then. This is like the early days of the pandemic when we, there's another one we could talk about, by the way.
The pandemic,
but it was just, we've made strides.
Yeah.
Yeah, the pandemic is another one. Sometimes people come together around collaboration and collective response because it just really is the best way to do things. And we all know that. And sometimes it happens as a response. So in the case of homelessness, this has been a long-term, the continuum has been there for a long time, and we all believe in this process, know it's the right thing to do. The pandemic was different.
Yeah.
The pandemic, it hit us out of left field. At least it hit me out of left field. But as a community, our response was so collaborative, and it was so many organizations getting on the phone, getting on Zoom, getting on Teams, and talking about how can we help each other to do what we need to do. I spent half of my life trying to figure out how to keep other people's doors open.
Yeah.
Not our doors, but somebody else's
Yep.
doors. And other organizations did the same for each other. So it was a different it was less systematic of an approach, but it was a collaborative and collective response regardless.
Yeah, I remember things like, we have too many gloves and not enough masks. You had extra masks, not enough gloves.
That was us.
Right? Let's do a little switcheroo. And you were like a great hub for that for us, because you knew what other people needed when we didn't, and you had access to some things that we might not have. And it just was so helpful to an organization like ours to know if we called you, we could say, hey, I got extra this, but I don't have enough this. Do you have an idea?
Yeah, and it took that kind of a mentality though for us to do that. I mean, I think people needed to, and maybe that's really, people often ask me about Nashua, partially because I'm not from here, right? Like so many people, I'm from away. And that's what we say here in New England, right? I'm from away. So I'm from far away. I'm from California. I didn't grow up here, but this is my home. I've lived here longer than anywhere else. But I have enough friends that are also from away and are still away that they'll say, well, tell us about this town where you live. And one of the things that I'll always say is that Nashua, I feel like, is a very special place in that we've built a culture that allows us to collaborate. And that means that most not all, but most organizations are, they manifest what I consider one of the highest qualities that you can have, and that's to be unafraid to admit that you don't know what you don't know. And to do so in a public way, sometimes maybe that's intimidating, right? Because, gee, if I'm not the expert, then what are people going to think of me, right? But I think in our community, generally, there isn't a lot of that. People really are willing to admit that they aren't the be all and end all. They don't know everything. They just know people. And when you know people, you can get stuff done because we can just pick up the phone. I call it I'm a aging baby boomer, right? So my daughter would say, this is one of my hey boomer moments, but I call it the mental Rolodex. Right? We all have this capacity that we built up in our heads to just pick up the phone and say, I don't know where to go for this, but if it's around, where do I find an AA group for somebody who's looking for one? I'll just pick up the phone and call down to Revive and say, Jessica, what's going on? Do you know who you can connect me to? And she might say, that's not what we do, but I know somebody who might. And she's unashamed to say, even though I'm the, person who's supposed to know about recovery, I might not know this answer. And Mike's not going to feel like that's a bad thing. That to me is the secret sauce of Greater Nashua. Our willingness to do that.
It's like a living and breathing 211.
Kind of.
Right, like I love 211, right, that you can call and it has information. I mean, it's such a great resource. And, right, if I'm calling looking for something for my family member, I'm not just going to call a number and say, okay, here you go here. I'm going to want to make sure, okay, who is it? What are they? I'm going to want to make more phone calls or, get somebody I trust. And so I feel like that's kind of our community.
It is. And I don't know how you replicate that, to be honest. That takes many years and a lot of trust.
Yeah.
And it's easier to lose trust than it is to gain trust. Like it's for me, the analogy there is, there are some people who you can argue with, and you can walk away from the argument and it's all good, right?
Mm-hmm.
And there's other people, if you raise your voice one time, you might never ever get that back.
Right.
And so you have to know your audience a little bit. But I feel like in our community, we're willing to, just express that vulnerability.
Yeah. For me, that's about compassion.
Yeah.
Well, one of our definitions of what compassion is, one of our other values is that a person is not who they are on one given day, right? That having compassion is the humanity and the recognition of a person, a greater person than just who they are. Actually, earlier today, I was on a phone call with a gentleman inside the state prison in Maine, and he is working on transformation from the inside out. And he and I had that very conversation about just that the stigma people have toward mental health is very similar to the stigma people have for people who've been incarcerated.
Right.
And how compassion in recognizing a person is
Yeah.
not defined by a day or a mistake or even a whole lot of mistakes.
Yeah.
But there's a whole lot more human to any given person.
I think that's true. I'm not I'm not trained to understand that really, but I do know, like, I got all sorts of analogies. Like my dad always told me, like, remember what that person had for a day. Sometimes it's maybe not the day you're having. So, one of the things I was going to say is that there's also a balancing act between a collective response and a collaborative way of fixing problems and working through issues doesn't get any of us off the hook for our individual accountability. And I think sometimes people need to realize that.
Yeah, it's a great point.
Because it is easy to, say, that all responses are not collaborative. Sometimes you just do things on your own, and it's part of the larger ecosystem of problem solving, right? But it's still okay to do things on your own.
Yeah.
And like, for example, again, back to homelessness, one of the things that we're very involved with is working to help end youth homelessness. And we have some great organizations in this community. We have Stepping Stones, which is just a fantastic resource for young people. We have the Youth Council, that's a great resource for young people. We have you guys, you're an incredible resource for young people. But also, I know that there are some things that some people can't do that we can do. And so I had a family, one of our McKinney-Vento liaisons, our youth homelessness liaisons, reached out to me last week. There's a family, they have kids, they got evicted from their apartment. They're now living they were able to cobble together enough resources to buy a van of some sort to live in, but kind of like a small RV, if you will. But what the McKinney-Vento liaison told me is, she said, Mike, I can't believe I'm asking about this, but they have no electricity, so the kids can't do their homework. And that's kind of a striking thing. Yeah, of course we need electricity to be able to turn the lights on and do our homework. I mean, of course you could probably buy some candles. I mean, come on. This is the 21st century, Cynthia.
We shouldn't have to do homework by candlelight.
We should not have to. And right. And so she asked if there's any resources I knew of where we could buy them a small generator. Of course, we can buy them a small generator. Nobody else can. Nobody else has an unrestricted fund of money that they've raised in order to support young homeless people. It just doesn't exist. Everybody else has grant funding and it's restricted and it's federal
Or
dollars.
services they have to pay, use
Yeah.
building codes for, or, right?
Yeah,
Right.
and they're big and they're complicated organizations, and we're like, okay, I have a little pool of money. This is why we jump out of airplanes.
Right.
We
right.
raise
To
money
create
by
a pool of
jumping out of
money.
airplanes.
Yeah.
And so, of course, yes. And so
Yeah.
on the way home from work, I felt like last week was hard anyway, so at least I could end it on a good note. I went home. I paid for the generator. They picked it up at Harbor Freight. They had it over the weekend. The kids are able to do their homework, go back to school today, and have their homework done. And that's kind of like what it's about. But that's the individual response as part of a collective greater piece.
Right.
It also means knowing who can't do things. So,
Yeah, that's such an important distinction because that's part of why we need one another, right?
Right.
And why it's important to recognize what our each individual restrictions are, but here's how I can contribute to you helping this way, and together we're doing it because
that's exactly right. Other examples, I mean, it's I saw Kathy, the executive director from Stepping Stones today. She has young people who are living outside, and there are a wide variety of reasons why a young person would choose to live outside versus going into an emergency shelter. A good portion of that has to do with that our emergency shelters are really places where adults are. Right. They're very much the average age being 40, 50, 60, not 20, 22, 23. And young people just don't feel comfortable in that environment. And also, I mean, I remember a little bit what it was like when I was young. I was more resilient as it came to things like the weather and coldness and the elements. And so I would have been more comfortable being outside, even when it's cold. Mm-hmm. So she had a need for some tents and sleeping bags for some of their young people. Now, the collective piece of that is she's established their organization as a place of trust where young people can come and raise their hand and say, I could use a hand. This is what I could need for help. They don't know about United Way. They don't have to know about United Way. Kathy knows about United Way.
Right.
So she's got the trust and we've got the resource. That's a team effort.
Exactly.
Right? And so sometimes collaboration and partnership can just be two organizations working together. It doesn't have to be a big, huge collective effort.
Yeah.
So I think it's lots of layers.
And it's, to me, it's a willingness to do what needs to be done for the greater good, right? Mm-hmm. Like, I think about our like the vision of a community that's thriving, and we each have a mission or a piece of how we create that vision or how that vision comes to be. But it doesn't mean we can do it alone, right?
Well, we always talk about this thing called social determinants of health.
Yeah.
Right. And I know there are probably some people watching who won't know what that means. So I'm just going to say, all health outcomes are not necessarily related to Western medicine. That's right. Like how healthy we are isn't necessarily a function of who is our doctor and do we have, good prescription coverage and can we get access to surgery? Like those things are inputs that are sometimes helpful and sometimes necessary, but the most important outcomes around health are related to, where do you live? And are you connected to other people? Do you have social connections? Are you gainfully employed? What are you eating? Are you eating nourishing food, which is good for you? Or are you eating things that, give you chronic diseases? Because what do they say? An ounce of prevention is way better than a pound of cure. So all of these social determinants being so important in our health virtually dictate that you have to have a collaborative response. Yeah. Right? Because who does all of that? The hospital doesn't do all that. Our friend John, St. Joe's, John, they're a fantastic organization. They do tremendous work in our community. And yet if that's all there was, that would never be enough.
Right. Well, and even though there are big social service agencies, if we're dabbling in nutrition, dabbling in housing, dabbling in this. It's hard to be good at all of those things.
It's not just hard, it's like literally impossible.
Right. And so
Yeah.
different people coming together to help a family or a community have access to
Right.
whatever it is that they need. It's
Yeah.
it's the way to make the community work. A community isn't, one big giant entity on a hill that, you can all come to me for everything you need, right? That's not a community. A community is
it's true.
a lot of different people, places, organizations working together for what needs to happen.
Yeah, that's right. And that's kind of my answer when my friends say what makes Nashua different is I say we don't have a lot of people in our community, organizations in our community that just say that I am that person on the hill, come to me and I shall solve all your problems.
Right.
We just don't. And I don't think we would accept that. Like you would be ostracized pretty heavy, pretty fast. I know that at United Way, we would have very little tolerance for that person or organization that says we're the answer.
Right.
What's the question? We're the answer. Like we're just not going to accept that because we know that that's just not true.
Well, I mean, I think about it even in terms, it mirrors how our mental health center works even around an individual, right? So it's not the therapist who has all the answers. It's not the psychiatrist who has all the answers. A person has a team around them, and the team is defined by what that person needs. But there might be a peer, another person with a lived experience with mental illness, and that person might be instrumental to a person's success. But we don't know that until we all come together and all try. So I think the same is true of mental health. The therapist is not the be all end all answer for everyone.
Well, I mean, look at also. I mean, I think your partnership that you've had with Lamprey in place for a number of years, your Integrate Health partnership, where you're providing behavioral health resources in a physical health space, and Lamprey is providing physical health resources in a behavioral health space. That recognition that the mind and the body are all need to be addressed in order to create a complete and whole healthy human being.
Exactly.
And your answer wasn't, well, I'm just going to hire a bunch of RNs and start taking blood pressure checks. And I know that, Greg's answer over at Lamprey was, well, we're going to hire a bunch of psychiatrists and start being the mental health people. Fortunately, you have each other at the other end of Prospect Street and can work together.
Exactly. And to me, it's also about creating that continuum, like using that healthcare example, right? There are people who are better served inside our shop or inside our organization, and people who are better served inside theirs.
Yeah.
And we don't have to be the be all end all to everyone, for sure. And I also get leery when people are like, "Oh, well, Cynthia, you at Greater Nashua should hire all these people." And it's like, well, can I contract with others? Can I partner with somebody?
That's
There are some things that I think we can do and do well. And there are some others. I mean, Revive Recovery, who you mentioned, is a great example of that. Like, we've been the treatment providers for drug court for a number of years since it began here in our community. But we've always had Revive on the team to provide the recovery support.
Yeah, that's
Instead
true.
of us hiring our own. For that population, for that program, it just made sense to have a partner to do that rather than hire people. We could have done, but for that program, for that group, it didn't make sense.
Yeah, no, I agree. Can I tell you about another initiative which is brand new?
Yeah, I'd love to
So
hear
I'll give it like a little bit of a teaser here. And this is also, I think, when we're talking about partnership and collaboration, collective response, one of the issues that we're starting to look more seriously at is the issue of digital equity. So, digital equity really means access to, all of the modern tools and resources that are available in the digital space, and making that more universally accessible, but also so that people, even when they have the access, know how to access the tools. So it's everything from the highway itself, which is the internet, to the tools that are the gateway to the internet, things like Zoom or search engines, that type of thing, to the actual devices themselves that you use whether it be like a Chromebook or, an enabled cell phone, a smartphone, that type of thing. And if we think about digital equity, we think, well, there's lots of us who have really tremendous access and use these tools all the time with very little barrier.
And when they stop working, we get really frustrated because we expect them to be working. We have such good access.
I still have a pen, but yes, we do. I absolutely agree. I used to say there's I spent a lot of years avoiding using a digital calendar because I do feel like there's a lot of bandwidth and permanency in paper, but there's also a lot of flexibility with the digital calendar. So we're starting to look at this whole, continuum of people, right? From young to old across a variety of demographic, criteria, whether it be that a person perhaps is a person of color or comes from a minority community or speaks a different language, or maybe they are lower income, or maybe they belong to a group like they're elderly or they're homeless, or they're in any stage of life, not necessarily a person like, dare I say, myself,
Right.
for whom these tools have been ideally designed and made accessible. So we have situations in our society and in our community for sure as well, where people might be experiencing loneliness and isolation. And there are digital tools available for us to leverage to address some of those issues. Now, nothing will ever beat a hug, an in-person, real good old-fashioned hug. And I'm a hugger.
Me too. So
but,
it's
yes,
all good.
but there are people who are isolated and maybe homebound, maybe bedbound. Maybe they have means, maybe they don't, but probably experiencing some level of social isolation and loneliness. And why, for Pete's sakes, in the day and age when we have things like Zoom and Teams and the internet and cameras on phones, when we can't have a person, like, why can you and I not have a conversation if we can't in any other way? My preference is always going to be in person, but I have the ability to make that happen.
Right. Somebody else might not, right?
Right. So addressing that is way bigger than United Way and way bigger than Comcast and way bigger than Greater Nashua Mental Health. It's an issue where we need to bring together a bunch of players at the table to figure out what are the issues, who are the people, how do we resolve some of these things, how do we do so in a way which makes sense for our community.
Yeah.
And so that's something we're just starting to look at now. What's our role at United Way is to pull people around the table and to initiate the conversation. But I can't say that we have the answers. We might have part of the solution, but we don't have all of the answers.
Well, and there'd be
stretch.
many answers in different places. I mean, what might be a solution for one group might not be a solution for another. So many ideas are needed.
Absolutely. Absolutely. So
you just said
I
something
like
really important. I think that kind of covers a lot of the examples we talked about, in that there's often a convener or a champion or somebody that just kind of holds people accountable to continuing to show up and talk about whatever it is, right? I mean, even if it's just two organizations, often there's still a need to have something on the calendar to keep coming back together or something, just to make sure we keep going, because it's so easy to default back to go back to my little silo and do my thing.
Head back to my corner. Absolutely. In fact, my colleague Sarah and I were meeting with one of our friends, Jay Minkara from the NRPC today, and we were talking about this and pulling together a convening, and ultimately my dream would be to have a coalition of people. And he said, Jay was so great. He says, well, he just like totally bought into that idea, and he bought into the idea of United Way being a convener for that conversation, and he loved the idea of NRPC being part of that, even though this is not necessarily in their wheelhouse, but conversation is, and the community is, and the same for us.
Right. So, I mean, the solution might exist outside any of us, but
I guarantee it will.
Somebody has to
Yeah.
start the conversation. It does make
Yeah.
me think about one of the things I'm most proud of that we did during the pandemic was we called it Consumer Tech Connect, which is not a
Yeah.
really great name, but where we deployed devices to some folks that didn't have them so that they could access not only telehealth with us,
Right.
but also telehealth with others.
Yeah.
And so they could still go to their doctor's appointments because
Right.
that was enabled on this device that we gave them. And so that really made it clear to me how many folks don't have access to some things that others of us really take for granted. So I applaud you in this effort.
I will say it was eye-opening to us when the pandemic started and the remote learning shutdown started. And ultimately we ended up distributing over 500 wireless hotspots to kids from throughout Greater Nashua who didn't have internet connectivity, and ultimately over 2,000 Chromebooks to kids who didn't have the device. So and I don't think we've fixed that problem. What we've done is we've gone back to an in-person model where that isn't as necessary. It's still, we still have those needs occasionally, but I think the problem is still there.
Yeah.
And I think this is a way in which we can also create even a greater community by making sure that people have that type of access. It's a big enabler. It enables you to get information. If with information you can get a job, you can learn a new skill, you can make a friend.
Yeah.
These are all really important life elements, I think.
One of the projects that you all do that's on my mind too right now is the shoe boxes for older adults. Right. And that's in some ways a small, not big collaborative project, but it takes a lot of people to get the stuff to fill the boxes.
It is a big collaborative,
right?
actually.
And we provide information about isolation and impact on mental health and where people can call and do. And in some ways, I think from the outside, somebody might say, oh, it's shoebox. But yet it still takes a village.
It does, because there's more in the box than just some stuff.
Right.
It's well thought through.
Yeah.
And it's thought through. One of the collective pieces of that is that we don't ever presume to know what should go in those packages. What we do is we'll ask our partners. We ask Gateways. We ask Meals on Wheels. We ask the caregivers. The organizations that have the clients that ultimately are the recipients of these care packages, what should be there, because we don't know. In fact, sometimes we make completely wrong assumptions. And I'll tell you, this is what happens when you don't think collectively. I always thought, how great would it be if we also had just a couple of sweets in there, a couple of pieces of chocolate or something like that. Well, so, I just thought, well, this is great. I ran with the idea. And my spouse, who happens to work with seniors at Gateways, turned around and I got like 4,000 truffles from Lint donated. And she's like, if you give those to my people, like 3/4 of them have diabetes. What are you trying to do here, man?
Save those for a different event.
I guess the collective response needs to start by talking to your spouse. I don't know. maybe that's a good idea, right? But no, it is. I appreciate the shout out on that project, because it is a collective impact project for sure.
It's one of my favorites, because
Mine too.
I think there's a lot of folks that go unnoticed in our community, and it's important we recognize everyone. Well, it has been a delight. Chatting with you.
I have been so looking forward to this, Cynthia. Can I tell you? Not just because the conversation I knew was going to be interesting, but also because it's you and everything you do for our community and everything Greater Nashua Mental Health does for our community and all the different ways in which we work together. I just love that so much.
Yeah, me too. We're really grateful to have a partner like United Way that keeps us connected to all of our partners and keeps us working collaboratively toward that collective impact and, dare I say, empowering us, right? Because this is the Empower Hour after all.
This is the Empower Hour.
So thank you for joining us on this episode of the Empower Hour with Greater Nashua Mental Health, and may you have an empowered day.
you.